Hi, everybody. I'm Ryan Shaw. I'm a faculty here at Duke, and this is our last session, which is on scaling up. And the goal of this is really to talk about. So you have a product. How do you scale it up? Not necessarily to the cloud, but to getting a potential funding. How do you talk to a VC, a venture capital? How do you pitch to them? What are challenges, and who are these people? We actually have some of them here, and I will introduce you to them. I'm first just going to do overall introductions, and then we'll do some discussion back and forth. We have some targeted questions, and then we'll take questions from the audience. So first up, we have Anita Watkins. She's the director of a strategic innovation at mHealth Ventures. She leads clinical evaluation, a partnership, and also a strategic opportunities with a portfolio companies. This is a venture that spurs actual innovation in healthcare, investments, and also partnerships. She has a JD and from UNC, among other degrees too. Next up, we have Dr. Blake Long, who's the chief clinical officer and a principal market development at Echo Health Ventures. He's the chief. And Dr. Long works with their portfolio of companies, and also they collaborate with various providers and also insurers. And he provides clinical insights into the evaluation of investment opportunities. He's a pediatric cardiologist, and a part of this was practicing at a Savannah Children's Heart Hospital. Next up, we have our very own Dr. Gary Bennett, who's the director of the Duke Global Digital Health Science Center. He's a professor of psychology, neuroscience, global health, and also medicine here at Duke. And he also directs the Duke Obesity Prevention Program. And last but not least, we have Dr. Dory Steinberg, who we also heard from earlier, who is a research scholar here at Duke and the associate director at the Duke Global Digital Health Science Center. Okay. So my first question will be targeted at Anita and also Blake. So would you be able to give us a really high-level overview of the funding pathway and where your company falls along that path, or just perhaps your role on that pathway?
So we're a venture fund. Can everyone hear me? I hear there's complaints in the back. We're a venture fund that's based within Rex Healthcare. We're a hospital that's part of the UNC healthcare system. And what we tend to look for in funding companies are companies that are a little later stage than some that you've heard from today, that are really ready to go live. They've gotten past the pilot stage, or they've gotten through some clinical trials, but they're really ready for a strategic partner to scale quickly. And so being a community hospital, one of the reasons we feel like our model works so well is the majority of hospitals across the country look like Rex. There's about 5,000 community hospitals, whereas there's only about 50 or so medical centers with hospitals attached to them. So the patients we see, the caregivers we have, our providers, they tend to look like the majority of hospitals across the country. And basically our investment thesis is, if it's going to work at Rex and work well within Rex and the UNC healthcare system, then we likely have a company that's going to be scalable across the country. We are stage agnostic, which that essentially means, if you guys are familiar with VC funding, there tends to be seed, Series A, Series B. We've invested as late as, I think our latest is maybe like Series E or something. So we've done as early as initial round of funding and much later funding. Really, what we look for is the strategic fit with the hospital. And to give you a quick example of that, one of our companies, Phenonic, which is a local company here in the Mooresville area. They're not your typical healthcare company. In fact, I think had they come through our typical deal flow process, we would have said, no way, this is not something we're going to invest in. They're actually a semiconductor company that is really revolutionizing how we cool. Their first products were chips designed to put on lasers and other devices to keep them at a room temperature or cooler if necessary. They then developed a refrigerator without a compressor, and that was targeted towards really the Asian market. And the CEO and I happened to be together one day, and he said, "You know what? We think that our technology may have application in healthcare." We got the folks around the table to start talking about what challenges we have in refrigeration across the hospital, and sure enough, their technology hit every one of our pain points. There's no compressor, there's no moving parts, so there's no maintenance, and that's a big piece of well, real big pain point within hospitals that we have folks fixing refrigerators that really were bought at Lowe's or and really shouldn't be housing medication. Um, the monitoring, if you don't have a device in the refrigerator monitoring the temperature, a tech or a nurse or somebody who should be caring for patients is checking that temperature twice a day to comply with JACO. There's also no contaminants. There's no freon because there's no compressor. All of it uses semiconductor technology. So as we ticked off all of these issues, it also maintains a much more consistent temperature, and that's really important for certain products in the hospital. So we look for fit that's solving a real pain point within the hospital, and it creates a great partnership. So,
Thank you, Nina. I am also in the venture capital. We don't wear horns for you entrepreneurs, it's really fitting that we finish off the afternoon talking about the money. Um, so we have a very similar strategy, but we're coming for Echo Health Ventures from a different angle, but it's the same principle, and that is investing as a strategic investor as opposed to just a money writing check venture capital investor. So my organization is affiliated with the payer space. So we are looking at a couple of things. One of the key items in evaluating solutions as a strategic investor from our perspective is who is going to pay for the solution, and that's a very important question. We heard that earlier today, and we can talk more about that. But then the second piece as a strategic investor is that what can we do to help the company go beyond that pilot stage? Because if you start interacting with a large health system or you start interacting with your solution with a payer or some combination thereof, a couple of pilots to go to the next level is a huge leap. To go from pilot to commercial, and there are a lot of dimensions to that which we can maybe get into. And that's where a strategic investor can help you convert from that pilot fatigue to really scaling. So that's not only providing capital, but it's providing some of that expertise and insight and access to multiple health systems or to multiple payers to really scale. And that's what I think makes the strategic investor that we both represent different than a generalized healthcare investor. And that would be the last comment I would make, is there's a lot of healthcare investing that's been done by groups that are really been investing in tech, and now they're moving over to healthcare. They sort of kick the tires, but they don't really understand how to invest in it. It's a shameless plug for Anita and I. But it's really important because the sales cycles are long, there's a lot more complexity. So getting capital from the right partners is very valuable to you as an entrepreneur, and they will stick with you for the long haul. So we are also stage agnostic. We go fairly early to very late stage. I think that gives us a lot more flexibility. Typical VC firms pick a stage and stick to it. So strategic investors tend not to do that. So there's some general high-level comments. We can get into some more later.
Great. All right. Thank you. So to Gary and also Adori, I was just wondering if you could just give an overview of perhaps your past and current experiences in this area, and what might be some challenges that you have faced that you might want to share.
Well, thank you. So I I think the challenge is in finding money. And I think the advantage to the venture that Dory and I are, the scale down, the venture that Dory and I are currently involved on, as well as the previous ones I've worked on, have mostly been bootstrapped, at least initially, meaning that we've raised our own funds or brought funds to the table in order to develop and kind of carry us through the initial stages of a MVP and a pilot. And that was certainly the case on scale down as well. When we launched scale down to the public, though, I think within the first month we went from 0 to 10,000 users, and so we quickly needed, and then it scaled after that. So we quickly needed a whole range of additional support that we had not fully anticipated, i.e., customer service and technical support. All of the things that many of the things that it sort of takes to sustain a real company, we had not fully anticipated. Sales and support as well, not to mention a whole new range of support for our computing infrastructure. And so raising capital was really challenging and really necessary for just kind of operational support. I'd say that we've been able to remain bootstrapped by investing heavily in sales, and so we sort of adopt the perspective that we're a small company, a small business, and not necessarily a startup, and that has led us to be focused really on trying to operate this as a revenue generating venture, not necessarily one that is in growth mode and that is looking to raise. So we've been sort of at the periphery of startup culture, and we haven't viewed raising as necessarily an indicator of our success. Rather, we've been really focusing on trying to generate revenue, and so we were profitable reasonably quickly for our size, and that's been very successful. I think that has afforded us an ability to be a little bit more selective in the process. As we're sort of transitioning now to thinking about growth, it's allowed us to be a little bit more selective in the kind of partnerships that we might make for fundraising. And in that spirit, I would say that our experiences with VC partners in particular have been very good. But I think it's really critical. Maybe my one word of advice is it's critical to know why you're raising and what you really need. And I think the previous points are really well taken. These are examples of strategic investors who really know what they're talking about. There are a lot of folks out there who will give you money to grow a digital health company, and I think it's important as a founding team to know: do you really need management expertise? I mean, there's a whole range of strategic advisors who know a lot about how to run a company and can just give you that core support. We had pretty significant supply chain issues sourcing scales from China, and at one point in the early stage of our company, there was a port strike in California, and we had several 100,000 scales that were on a boat that couldn't get into the United States. And so the question is, well, how do you get them here, right? I mean, I have a PhD. I have no idea how you get them here. Right? I have no clue, right? So it was really clear to us pretty early on that we needed that kind of operational support. And so that's a whole layer of investing that can give one access to folks who can help there. Payers, getting access to the payer space and thinking about how you diversify your revenue base is also a really clear reason to look to raise. And so I think for us, we have not yet decided to raise because we haven't yet felt the need to grow in one of these areas. But it's allowed us. We've been very focused on where the gaps are, so that if and when we make that decision, we'll know where to go. Sorry.
I think Gary summed it up really well. I just want to add to it as somebody sort of background is that, we're researchers and sort of trying to get into commercializing and scaling up some of our evidence-based programs, which was really the motivation behind why we started Scale Down. And that, as somebody who has received research training, I received no training in how to run a business or how necessarily, all these things that Gary's talking about. And I think by having, resources or people to be able to reach out to who are not just investing in, their product, but really trying to invest in helping researchers be able to take that next step. Because I would have never anticipated, the challenge. When we think of designing an intervention and testing it in 200 people or whatever we do, we don't really consider the customer service needs, for example. And so when you scale up to 10,000 people within a month, that is a main focus that is just never really touched upon when we think of testing this, program and seeing that it's effective. So that was just very educational for me, and I think, for those who are interested in this, because I know, about half the room are really researchers who might be thinking about how they can take their evidence that they're working so hard on their lab and translating it into industry, into the commercial sector to have scale. Learning about these things ahead of time and really looking for the right people to help you along the way can be pretty impactful and incredibly helpful.
Great, thanks. So you guys mentioned sales. You mentioned also a payer. So how do you decide who does pay in the end?
So, I mean, that who pays is probably one of the most important issues to consider. We see companies all the time that are really great ideas, but if there's no obvious pay mechanism, whether it's, there's already a code that allows it to be billed for insurance, and that's in and of itself is a pretty difficult process for a startup company to go through. Or if there aren't avenues that it's obvious that it's going to be a consumer product, or obvious that there's a physician groups that are willing to pay for it as a service. I think that in every, every company should stop in your tracks right there. I mean, I have companies say to me all the time, but we can demonstrate ROI because we're going to reduce FTEs. And I can tell you that falls flat with almost every director in the hospital to say this technology is going to reduce FTEs. Their FTEs, they're never going to let go of positions. So to try and argue, oh well, then you're going to save money because you can allocate those resources somewhere else. Again, that argument falls flat. You guys know how stretched thin our folks are within the hospital. That's not demonstrating an ROI through reducing FTEs or some other form of efficiency really falls flat in the healthcare system. There needs to be a way to pay and monetize for the technology upfront.
Yeah, I would agree with that. You have to at least think that through. So it goes back to you've got to really make sure you understand what problem you're really solving and how valuable that is and who is willing to pay for that. It may not be so much who's going to write the check, but who's really going to value it and pay for it. So this, just like the efficiency, one of the arguments that tends to bump into the wall that the payer struggles with is add-on cool app. We get a ton of these that will solve a problem that will just charge another 30 cents per member per month or per engaged member or something like that. And you say, oh, 20 cents, 10 cents. That's really not a lot of money. But if it's 500 apps that are or solutions that are getting added on top of a PMPM, suddenly the employer who's buying that from the payer, for instance, is now seeing a bill for $400 or $500 per member per month, and that gets really serious money. So you're stacking on something, and that's so we see that payment stack. And the same problem for a payer is a vendor stack. So if you come in and say, "I'm going to solve your operations problem," as a payer, you're getting into a solution stack. So you have to be very careful in your articulation of what your true value is and who's going to actually pay you to do it, whether it be a provider or a payer. And we see the PMPM is that's a really that you're off on the wrong foot if you're coming in and saying that's how it's going to get paid for. It may be how it'll be paid for, but that's going to be a harder hill to take.
I think this is one of the real challenges for researchers generally, and for those of us in digital health specifically, is identifying, is really thinking through the payer issues. I guess two thoughts that I think about a lot in this space is that there's a real difference between need and demand. So there's lots of things that we really need to do and our patients need, and that would be really beneficial to the health system, for which there is no financial demand and no very clear payer. Another kind of closely related issue is that there's a lot of things that should make sense in the health system that just kind of don't. So I do obesity treatment, and obesity is a huge epidemic, and it's killing many Americans. We should be treating it actively in the primary care system, but there are lots of reasons why asking your doctor is not really great advice for obesity treatment, because it's a very challenging for obesity to be treated in the primary care setting for lots of good financial reasons. That doesn't make sense to a lot of us who invest our research time in the area of obesity treatment. But I once had I was once talking to a payer who was a payer who's a health insurance company, and they said, look, yeah, we should probably know that obesity is a major issue for our members, but the problem is we also have read the evidence, and we know that weight loss doesn't save money until about 24 to 30 months. And the problem is that we tend to churn members, i.e. our members tend to leave our member rolls at about 18 months. And so we're not going to have them long enough for the cost to accrue to us. So why would we make an investment to try to do something about this? And you know, I think when you understand this from the perspective of the payer, it makes a lot of sense. It's changed the way I think that we pitch our products, but it's also changed our research a fair bit, thinking more critically about who the actual adopters of some of these technologies will be, as opposed to kind of pretending or imagining that they may be the health systems themselves.
I'll just make one other. That's the current state, is that problem. But there's a whole new environment that's emerging, and I think you all could probably comment on this, that's really going to change the value equation on its head, and that's that we're going to pay for outcomes. And so when suddenly the providers take risk, then the conversation is about not how can you add on per member per month, but how can I actually help you manage your risk and save money? So revenue sources become cost centers in a lot of situations. And that's when you could literally flip your value proposition. So I would say as you design, kind of think about that environment. And that, I think almost no matter what happens in Washington, that train is moving along in the environment. So think ahead a little bit about that. That conversation could change a little.
And I would also, just on the other side of the coin, is what you charge. So make sure that when you're doing your research around what to charge for your product, you're actually talking to the decision makers. I just had a company yesterday pitch to me that they're charging a premium for a product, much higher, several $100s higher than the technology currently being used. And I asked him, so what are you basing that price point on? And in part, they were basing it on nurses and physicians said, oh, yeah, we'll pay that. Nurses and physicians do not write the checks. So make sure you understand the process by which your product will actually be bought and who's going to champion it, and the formula truly for success within the healthcare systems. And again, that's going to change. Just like Blake mentioned, that it is changing, but right now we have models where there is a process by which every single purchase goes through, and it might go through a VAC, might go through some other form of committee, might be allowed to be fit into a director's budget. But you need to understand that piece when you're pricing and also when in your sales strategy.
Yeah, I don't want to jump on, but that's a very important point. And I mentioned pilot fatigue. And so one of the things as you're partnering and doing a pilot, whether it be with a payer or a provider, pay attention to, does that person that's helping you do, or team that's helping you do the pilot, do they have that strategic insight and strategic decision making to convert that to an enterprise-wide solution? The answer may be no. So suddenly your pilot stays a pilot and will never be more than a pilot. So as it's getting started as a pilot, be asking the questions, do I have the right people in the room to go to the next level? Will help you navigate to get to that point. And if that's done early, then that next step happens much more quickly. Otherwise, you'll be stuck at the end of the pilot. That was really nice. You know, we're not going to go any farther. So, very, very important point.
Sorry, now I guess I am piling on. I like this. Maybe if I translate this a little bit for those of us who do research in this space in the room. So for those of us who do, say, dissemination and implementation science in this space with the eye toward trying to translate innovations into real life practice, there's a very explicit focus on trying to understand contextual considerations in implementation science. So how are the tools being used, and what's the uptake like in the clinic by the providers, by the nursing team, and how do you get staff to transition to adopt a new technology and those kinds of things. I think that's all fantastic from a science perspective, but when it's devoid of the actual of adopter consideration, so what does the CMO think and the CFO think and the folks who are actually making the decisions, then I think you actually have a barrier in the translational process pretty dramatically. And in the health incubators I've been spending some time with in the last year, I see a lot of pilots that are conducted with a lot of input from doctors and nurses, but none from folks who make the funding decisions. In our first company, which is like around 2007, 2008 right now, we got very good advice very early on from a CFO who said, don't actually build the technology. develop the architecture, scope it, figure out how it's going to work, but don't actually build it, because none of the folks who are the actual adopters in this space will actually acquire your company if you have the technology. They really just want the plans, and they want you to come in and build it in their existing systems. They spend millions of dollars a year building their systems. So tell them what you're going to do, and don't show them something that you've done. And so it was a very radical approach, but we were acquired in about 6 months, and that was and it made a lot of sense.
Thanks. So I heard, Anita, you had said a pitch. So how might us as an audience, perhaps a pitch to both you and Blake, like, what do you expect? Do you have any tips or?
So this is where we can play buzzword bingo. Are you asking how do companies get in front of us, or what do we expect to hear in a pitch?
What do you expect to hear?
Okay. So, we had a call to prep on this, and we've, over the 5 years that the fund has been in existence, we have started what we call buzzword bingo, where if we hear certain things said during a pitch, it raises red flags for us. We integrate with Epic was one of them. I think that's been touched on quite a bit. Some of the others that I wrote some of them down. We're going to have $1 billion in revenue within 5 years. That's another one that which shows a lot of enthusiasm from the company about their product, but typically does not show any understanding of what sales cycles look like within hospitals. I won't go through all of them, but I think the key things we really look for is a true understanding of the users, the end users of the product. And so that's very different from who pays. It's going to be the folks that really are using the product on a day-to-day basis. A great example is a company that we're invested in, actually technology that spun out of Duke years ago. First, they started Advanced Liquid Logic. The spinoff company that we're invested in is called Babies. It's a microfluidics company focused on early detection of lysosomal genomic disorders, and I'm hoping I'm saying that correctly. And newborns. And when we invested, they already had a product in development, but they were looking to develop a new product that would be used at point of care. And so they sent their engineers in before they even put pen to paper. And the engineers followed our neonatologists, our postpartum nurses, and other clinical care teams, and with newborns to really understand workflow. And then they came back with styrofoam prototypes and said, hey, this is what we're thinking of how this device would work. And our nurses said, I don't like the size of that cartridge. Where am I going to store all those? Do I really have to put it in this way? Couldn't it do this? And does it have to be that big? So I think that what we want to see from companies is that they have really done their research and that they understand their end user. So that's one piece. The other piece we've already touched on, they understand how to sell. They've got a team in place that really understands. They've been through the process, and they're going to get the sale done. Also, a team that truly understands how long it's going to take. We see companies all the time that says we're going to have 50 customers by the end of Q1. No, you're not. The 10,000 is amazing, but if you're selling to a hospital, it's going to take 3 to 4 times longer to get in front of folks than you think it's going to. And then once you get in front of them, it's going to take 2 to 3, maybe 4 times longer to actually make that sale. So I think those are the key things we really look for in a pitch, is to make sure that understanding is demonstrated.
I would agree with all of those. And I think a couple other things to add would be, again, clear understanding of the user and your idea. I think in addition to the sales and how much is involved with that, the investor really does want to look at what's the team. So you need to actually very clearly articulate who's on the team and what their capabilities are, and you need to probably articulate what capabilities you don't have and your plan for getting them, and that may be what you're going to use your capital for. So what you're going to use the money we're thinking about giving you, what in detail you plan to do with it. And lots of times that's expand the team, because it's team, 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 team. You can have a great idea, but if you don't have the right team, it will not go. And then I think another thing is some demonstration of understanding your competition, what's really out there, and how you differentiate yourself, because there's a ton of noise in this market. And so how are you really differentiated, and be realistic about that. And then I think another thing is some sense of clearly articulating you are a company and not a product. And that's a really important point, because we invest in companies that have good products. It's hard to invest in a product. So you need to really figure out what your story is. And that leads to the last piece, especially I think it's important in digital health, is you may have a great solution, a great product, but a company has to connect that product to the ecosystem, the platform, whatever term you want to use. So you need to understand how it's going to fit in, and more importantly, how you might develop additional products to go along with it, and what that roadmap is. So hearing a pitch that's articulated and understanding a lot of that, it may not have it in place, but you've thought a lot of that through, is probably a relatively sophisticated company, as opposed to just a product that's really, shiny and bright, and hope you give money and you'll be $1 billion company in how many quarters? 5, 6, yeah, exactly, whatever. Got it.
Interesting. So to Dory and also Gary, I was just wondering if you could perhaps share some different experiences that you might have about maybe giving pitches, both pros and cons, or lessons learned.
Well, I can start as, as a researcher. The pitch is very different from a presentation you might give at an academic conference. That was pretty clear to me, and sort of, that we really think a lot about the evidence, and how you need to, when we're talking about our evidence the research that we do, it's all about this is what we did, and this is what we found, and this is why you should be interested in this, because these results are so strong. And I think that and you guys can add to this, but that I think, does it work is important to have in a pitch, but also sort of getting into more than just this is what the evidence is, and that this should be convincing enough, but really sort of thinking about how you can be persuasive in your communication, and how that can be then understood by people who are not academics, who are looking more about thinking. They have different, they're looking at it through a different lens with a different outcome per se. And I think that was eye-opening for me as so the person who was the expert in our what we decided to do more in the content and the approach and the behavioral approach, and not necessarily in the sales, in the marketing and all that, obviously. So I think that just kind of having that understanding is helpful before you go into giving a pitch.
Yeah, pitches are humbling in a lot of respects. We are, I think my experience is one way in which they're the same is that they're both kind of persuasive appeals, right? So when I write a paper, or I give an academic talk, or you're doing a pitch, so it's all about trying to persuade people either to kind of understand your science, or to appreciate the product or venture that you're trying to create. So in that way, they're very similar. But I think for us, for me, one of the challenges has been trying to ride the line between really showing our stuff and showing how engaged and excited and we are about the product, and showing off its abilities, but also being really clear and allowing yourself to be vulnerable about where your deficiencies are. And that's a very unfamiliar kind of feeling, I think, for a lot of academics. We don't spend a lot of time revealing our inadequacies. And I think one of the things in pitches is it's important to be very clear about what you don't know. And so it can be kind of comforting and kind of liberating in some sense to say, look, I have some thoughts about this and where this go, but really what I'm looking for help to try to help me to grow this in the right direction.
Interesting, yeah. So you mentioned research. So for the academics here, how important is research?
I just read a blog post from my favorite blogger in the health tech area. Her name's Lisa Sunan. Her blog is Venture Valkyrie. How many of you read her?
Okay. It's a recommendation.
Yes, definitely subscribe to Lisa's posts. Her most recent one, she borrows from Queen, Bohemian Rhapsody, and basically rewrites the lyrics about the woes she's seen and pitches of just forgetting to demonstrate your research, forgetting. One of her bingo buzzwords was, "Well, I had my grandmother fell and broke her hip, and I started this company based on her experience." It's great to have a personal experience as inspiration, but if you don't figure out whether grandmother's experience is one that lots of people have, you are going heading down the wrong path. And that's basically the point of her blog. But it's so important to demonstrate that you've done your homework, you've done the research, and importantly, we're in an academic medical setting, and this is it's I come from higher education. It is so important to do research and to understand, to create new knowledge, but get outside the medical center to do your research about companies that you want to sell to across the health spectrum. The population of patients within an academic medical center is not reflective of the population of patients across the country. So make sure when you're doing your research that you are looking outside the medical center for your research subjects. Not easy, but there are lots of community doctors who are willing to partner with you. And I think it's worthwhile to look at that as part of your research.
I'll just say a word about that. I think for us, very early on, the fact that we do most of our research in medically vulnerable populations who find their way into primary care via community health centers was really instrumental in shaping the direction of our product. And so it meant that for scale down, we decided not to create an app, and instead it's a text messaging based product, and it was designed specifically because in our research we find that even though there's 65% penetration of smartphones, there's 99% penetration of text messaging, and so that was the primary interface that we utilized for the scaled down approach. It also meant that when we decided to use scaled down basically is a network connected scale, a cellular connected scale, and a text message that you receive 2 to 3 seconds after you stand on the scale every day, and it personalizes a weight loss treatment to you over time. But it meant the scale that we chose was not Wi-Fi or Bluetooth enabled, but it was one of the cellular connected scales in the market, and that came explicitly out of the research that we do, which is decidedly not in the Duke patient population, because we're interested in populations that have higher risk for obesity and cardiometabolic outcomes. It contributed to the product in somewhat an unanticipated way. It meant that we could scale more easily. So when we hit all 50 states in the U.S. With scale down users, it was mostly a function, I think, of having the combination of technologies that were able to reach at that level, which we wouldn't have known if we had been working in the kind of traditional academic medical center population.
Interesting. Thank you. So we know that both Gary and Dory have this great product. So how do they go about getting in front of you guys? Who do we contact?
Deal flow is how do you start on deal flow? So I don't know how many deals you see, but we get hundreds and hundreds of incoming requests. It's you meet somebody at a conference, you expect a couple of you to come approach me, kind of thing. So there's that. There's the networking. It's pitching and meeting other people. We actually exchange deal flow, so that I'll see a cool company and hand it off. It's a little tricky though. Looking at it from the entrepreneur, you really have to sort of knock on a lot of doors and just make phone calls and be willing to take no, be willing to say I'll get back to you, and just keep at it a little bit. But it's a tough road from your perspective. But you have to remember, looking at it from our perspective, we get 500 plus, a year, and we have to filter that down to a small number that we're really going to do diligence on. So that it's a two-way street would be my comments. But I think you just have to be very. I imagine this thought just occurred to me. I imagine it's sort of like you're a great writer, and you have to get published. I know we can kind of do that on our own now, but in the good old days, that means you have to be told 400 times that it's a terrible book, and 401 you actually get through and it becomes a New York Times bestseller. You just got to kind of stick with it a little bit. Would be my comment. I don't know what you guys experienced or that. Yeah, okay, that's you guys described it accurately. You want to make some other comments on it?
No, I mean, we really get our best deal flow through relationships. Yeah.
Exactly.
And so from an entrepreneur's perspective, how do you break into that circuit? I think Blake's right. It's persistence, because I get a lot of cold calls. In fact, I've seen my email blowing up today of, um, and sometimes we get excited about, oh, this is actually kind of interesting, but for the most part, I think I mentioned to someone earlier, cold calls I maybe get through half the email, and then I'm like, okay, I've seen this one before. And it's really going to take a recommendation because there's only two people on our team, full time. It's really going to take a recommendation from someone like Blake. In fact, Blake's former colleague just yesterday sent me a company that I looked at last year, and thought, yeah, they're a little too early, for us, and wouldn't honestly look at them again had Maureen not sent them to me. So I think that, unfortunately, is persistence, is the name of the game.
But to add on to that, part of our job is we don't sit in an office and wait for us to call each other or sit around. We're actually coming. We're out to events like this all the time. So you need to do the same thing. The more you go to events like this, the investors are going to the same events, and we're sitting in the back of the room going, "Oh, that one sounds kind of." I've got actually notes here. I need to talk to that one, and that's how. And so I'll look at it and go, "No, it's not for me, but I know it might be for Nita." And that's how you just got to kind of stay with it. And I don't know what your experience was, but that's kind of how we look at it.
I think that as an academic, you have chosen a life that is replete with rejection and right, and requires persistence. So I think that the qualities are the same.
How many grants get turned down?
Exactly.
I got it.
Awesome. Well, persistence, and also it's also who you know, and also a networking are very important things.
Yeah, and I would say have your elevator pitch. I mean, everybody talks about that, but it's really good if you can get it down to, I can get in a 2-minute conversation and at least give me as an investor some sense about what your company is and what its potential is to get that hook in. So that means practicing, and it's literally an elevator pitch. I think you just need to get really good at that.
And the last thing I would add is, please do your market research and
Yes.
understand whether there are already 30, 40, 50 companies doing the same thing that you are interested in doing. Because that's when I don't get past the first or second sentence. When I see something that's just, the market is so crowded. An example of a company that we're invested in that Duke just went live with is, they're called Find, and it's nothing sexy. It's a database for provider data. Really hard thing to do for health systems, to keep all your provider data, have one source of truth. Find has figured out a fairly simple way to do it. If you go on Duke's website right now, their Find a Doc, you can use natural language processing. You can use, basically, in 1 or 2 clicks, you can get a very short list of physicians, and that's just one application of their technology. Um, it's Again, it's not sexy, but it's niche. No one else is doing it, and the ones that, there's 1 or 2 out there that are doing it, aren't doing it near as simply and beautifully as Find is doing it. So I think that's really important. I mean, patient engagement, reducing readmissions, all of those. I mean, there are so many companies that are out there already doing that. So make sure your research is in a niche space, and look for that really unique application.
All right. Thank you. So I'd like to open this up to the audience now for questions. Just please come up to the mic. Anybody?
So in a past life, I worked with investors. I did due diligence for them. I got the fun part. They ran the numbers, and I came in and did business strategy, operational aspects. But I worked at all different levels. I had VCs, I had venture funds. I also had some angel groups as well that I worked with. And so, just question to you as kind of the ones looking to maybe look at the deals. your strategic investors, which you go kind of more along the range. But there were a couple of things that they said to me, and I just kind of like to get your take on it. One is that you go and you talk to the VC people and the investors and so forth before you need the money, and you establish the relationship over time, so that when you come to them, when you do see that email from them and your hundreds, chances are you're going to look at that. So that was one thing that they said.
Great advice.
Okay. The second thing was knowing what the model was for that particular investor. So, you go in and you say, okay, their criteria is whatever, early stage or late stage, this size investment, this type of technology, or something along those lines. Do you have that kind of criteria out there that somebody's coming to you if they go to your site or if they reach out? Is that something that's visible to them, or is that something that they have to research or establish that kind of relationship to get that?
I agree with both those points, and that's actually great advice. I think we sort of project that we are in a general area, healthcare services and IT. So, for instance, we're not going to be in the pharma device regulatory risk from an FDA perspective. So that already helps some companies narrow down.
Right.
And then we can get into conversations. Usually, as part of the pitch, we sort of begin to outline what we're interested in, and that helps a little bit too. But yes, we hopefully are projecting, at least through our website, some sense of that's not what we would be interested in.
Yeah, because that's what I saw was a lot of
Right.
kind of people are doing a shotgun approach, and it's like there's no point in doing that if you know what their model is. So just the fact that you didn't research them enough to know the model
Right.
already kind of puts you in bad standing.
That could be a red flag, right?
Yeah.
And then the other thing about getting to know them early, I think, is a great piece of advice. So, for instance, we end up are taking a lot of pitches where I know almost right off the bat that we're not going to invest in them because they're too early. They're in the seed stage. They really are probably looking for capital from a different kind of institutional investor, or maybe really
Right.
angel money. So why bother? Well, the answer is exactly what you pointed out. I want to know about that company at this stage, because when they come for the money level that I'm willing to invest in, I will have already have the relationship. I'll understand their business model. I'll be able to say, I know how much they have accomplished to get in front of me because I knew what they looked like back here. And that means I know they can do it.
Yeah.
And that's a valuable piece of information. So don't be afraid to talk to us, even though we may not be necessarily ready to do it. But that relationship can go a long way and come back a year later or 2 years later, and you go, "Yeah, we talked last time." That can be very helpful. So that's worth pitching on. Yeah.
Yeah, and I think we try to communicate what our criteria are. I can tell you right now, don't go on our website. It's woefully out of date, and we're supposed to be launching our new one next month. And I hope that will a little more clearly communicate what our criteria are. We haven't drawn real bright lines because we find that when we did try to draw bright lines early on, that we had deals like Phonotic appear. I mean,
Agreed.
who would have ever known we would have found a company that had such a great strategic fit in refrigeration? But it's turning out to be one of our best investments. Our folks love it. We just put 55 of their units in the new heart and vascular hospital that opened last month. And the nurses, everybody are like, we love this technology. Like, we want the whole hospital outfitted with this. We couldn't have predicted that had we drawn a real bright box around our investment areas. So, honestly, our key area is strategic fit. If you've got a product that's going to fit within the hospital and we've got expertise to evaluate it, my partner and I are not clinically trained. So we rely on the clinicians and the other providers, operators within the hospital to really help us with that evaluation. So if we've got the expertise and it has a true fit, hitting a key pain point within the hospital, that's really what we're looking for.
Mm-hmm. And then I want to draw on from a company side. There was something that you said about bootstrapping, that if you're going to bootstrap it, you basically, you can't kind of, going back to the comment that you're not investing in a product, you're investing in a company. And when you're bootstrapping it, one of the things that, you said is that you were kind of focused, you were trying to keep your costs down, but then when you rolled out and you went up to 10,000, you realized, whoa, customer service and things like that. And so another individual I spoke to more recently from the investment side said, if you're going to if you're going to develop your business, you develop as though it's going to be a sustainable business, regardless of whether or not you're looking to be acquired, get funding or whatever. And I've said the same thing in the past when I've worked with investors, is that if you're especially looking at early stage, it can be so hyper focused on the product that the whole foundation on which the business is built is a house of cards. And I'm just curious, as you were going in and bootstrapping it, some of it may be you saw that you needed those things but just didn't have the money. But were other aspects that you were kind of hyper focused on getting the product out there and generating revenue to then, come back to your business?
Yes. Right. I mean, so all the above. I think. I think sometimes in these conversations, particularly in the startup space, we divorce this conversation from the way that most small businesses get created, right? Like if you look at the way like a restaurant or, a mom and pop shop, dry cleaning or something starts, people often start ideas and companies around products, and they kind of grow into the company. I think that would be the kind of modal way that you see many companies develop. So I think that the ventures that we've been involved in probably look a little bit closer to your local dry cleaner in some respects than they do to the startup, in the sense that we're very focused on creating a product that was sort of within our core set of competencies. We established relationships with and partnerships with large customers who were able to kind of fund our initial growth, and we kind of figured out in the early stages that really quickly what we didn't know, and then used the resources that we're making from those customers to try to invest to make up for our deficiencies. So some of those things we could project, like I think we had a sense that we would have customer service needs. What we didn't project was the rapid pace of growth.
Sure.
And the degree to which, and we sort of were adopting a model that's not uncommon, I think, in the really early stage space. You see a lot of companies that say, look, where the founding team really wants to get involved in things like customer service and technical support, so you can get to understand your end user at a really high level. So it was Dory and me and co-founders really taking support calls late into the night, and I think it taught us a lot about the product, a lot about our end users. And then there was a point, so that was quite an intentional decision in a lot of respects, but then we kept growing, and so there was a point at which we weren't able to keep up, and so then we needed to find additional resources. When I say bootstrapped in this case, I don't mean that we were investing our own resources. We were deploying the resources, revenues we were earning from our customer back into the business, and then making hires in areas to kind of round out projected areas that we projected where we were inadequate, and then we found a whole new set of things, like who knew that for a company that doesn't use a Bluetooth or Wi-Fi connection, that you'd have people in the middle of Iowa emailing you in the middle of the night saying, "What's my Wi-Fi password?" Right? And those are your customers. You need to find a way to respond to them, right? There's, and that revealed that we needed to beef up the way that we handled customer support on our website, and to rethink the, sort of design of our marketing sites. And so all of these things kind of helped us to figure out areas in which we needed to grow. Some of them anticipated, some of them unanticipated. So I'm glad in a lot of respects we did it this way, but I'm sure there might have been more efficient ways to the same ends.
Yeah, and I think every investment is a little bit different. It's just that my experience in working with startups is just they get so hyper focused on the product itself that they lose sight of some kind of fundamental underpinnings of the business being sustainable. And I have to think from an investment standpoint, you're more likely to invest in something. Obviously, it has to be a good idea, a good product, but if it has those underpinnings, that's something that minimizes the risk to you. Even though you're strategic and can provide help, you're not probably active investors in that you're going to throw a management team in there. And so, you're still going to want that.
Right. So that brings up a characteristic of the team, and that is adaptability, because I think you guys are sort of hinting at it a little bit, that most companies that have that product are building a company around it, and they have a pretty good vision about what they think they're going to do. And as they start growing, that's not going to work. And so they can either not succeed or they can adapt. And I don't want to use the word pivot. That's a little bit of a problematic word sometimes in this space, but the ability to adapt and go slightly in a different direction with their product or their company is really important. And it sounds like you guys did that to some degree. That adaptability is also a key feature that we would be willing to invest in, because otherwise if they can't do that, and you don't see an ability to do that, it's a little more risky.
So another point on being hyper focused on the product that's been touched on quite a bit today that I can't underscore enough is understand, at the risk of using another buzzword, but understand the ecosystem. So it's great to understand your product and really great to have that adaptability, but understand whether the industry's ready for it.
Mm.
So one of the things that we have seen, we've seen great companies with great products. And then when I get them in front of the folks within the UNC system, we might not even have a decision making process to address a product like that. And if the company doesn't understand where the industry is, they're going to run into a lot of trouble. I think I love Drew's point that we have tons of companies out there solving lots of problems. And it's not that we need to innovate more ideas. We need to innovate within healthcare. We've got to change the way that we deliver care to allow for some of these solutions to actually work. And so, from the startup perspective, understanding that ecosystem, understanding like where the healthcare systems are and are they ready for your technology. Some of them, every healthcare system is going to be at a very different stage based on what their priorities and their strategic values are. But find those that are ready for your technology, and it may not be the ones in your backyard. You may need to go look for partners in other parts of the country that have placed a premium on doing what your company is doing.
I'll just give a very somewhat dated example of this. So after my first company, I went and worked on the other side in industry for a while at a large disease management company, and then was in the position of evaluating pitches from startups that were coming to try to add to our PMPM stack. And one of the ways that we could very easily distinguish between companies that we were going to do deals with and not is that if companies came in and had a great new idea that required use of patient emails, we could just show them the door after the first 5 minutes of the pitch, because we were in our industry, it was not common to have access to patient emails. And again, a little bit dated, things have changed a fair bit, but it just reflected the fact that our part of the industry was just, we did not have reliable access. We knew we would only get a 5% response rate, and so it wasn't reasonable to make investments in that area with the sort of lacking data resources that we had. So it just spoke to the need to kind of do more research and to really understand the market and to identify the right folks to be pitching. Otherwise, it was kind of a waste of time.
Great. Just one last comment on that you asked about. It sort of gets at this. One of the ways you might be able to research it as a company is look at competitors or companies that are similar, and look at the investors who've invested in them, and go do homework about those investors and try to get some sense of why did that investor invest in that company, and do they invest in similar types of companies, or are they just sort of a vacation kind of investor? I do a little healthcare investing, may not be the strategic partner you want, as opposed to Anita's fund where that's the real one you want. So you can actually do a little homework by looking at what other investors are in certain types of companies and kind of work backwards.
Anita, you just kind of sparked a question in my mind that wanted to follow up on your comment about the national environment. How is the local ecosystem here in North Carolina, here in RTP, compared with some of the national healthcare market?
So I think we are so lucky in this area to have both UNC and Duke. It's an incredibly rich environment for startup companies, especially in the healthcare space. But I can say that our area puts a premium on certain aspects of healthcare. For example, Find is a Texas-based company, and Duke and UNC are some of their early adopters. They're great hospitals in Texas. They haven't found the traction there because they're not putting the same premium we are on that particular issue. So, for example, Carolinas has a mobile first strategy. They believe that most care in the future is going to be delivered through your mobile phone. So, they're putting a premium on identifying partners that have the ability to deliver some level of care through a mobile device. So, I think it's understanding the different hospital system, what they're putting a premium on. Providence Healthcare is one of my favorites, and we work with them quite a bit. Huge hospital system in the West Coast. They hired a guy named Aaron Martin from Amazon. He started Amazon self-publishing, which you just touched on earlier.
Right.
He started that whole arm within Amazon. Not has doesn't have a healthcare background, but they brought him in to rethink how they deliver healthcare. They wanted somebody completely outside the box. And a company we just heard a pitch from last week, Zelf, spun out of Providence because Aaron went and hired two really talented software developers who've never worked in healthcare, but had a really unique way of seeing problems and solving them with software. So it varies all over the country, sort of what kind of niche they have. Montefiore in New York, they're doing incredible work with Medicare and high risk patients. So there's a lot of really interesting opportunities. So if you're looking for pilot partners, find that hospital system that is really interested in your space. And again, it may not be your home base hospital.
Right, well, last question.
Okay. So I had a question about this sort of general model that we're working with. So we've heard a lot today from folks who are in entrepreneurship, those who may have backgrounds in business, and I am curious if there are opportunities or options for creating products within a not-for-profit more orientation rather than a startup or small business orientation. Is that possible? What does that look like? Are there examples of that? Thanks.
Um, we don't invest in them, but yes, there are definitely lots of examples. Just last week, I think there's one other person here. I judged the Lulu games over at NC State, and I was judging the teams focused on social impact. And there were some really awesome teams and ideas, especially in the healthcare space. So I think there's a lot of entrepreneurship opportunity in the not-for-profit space. It's not our area of expertise, just because that's not the area we work in. But I think there is definitely opportunity, and I think there's great resources out there to help.
I would agree.
No, I was just going to say, I mean, at Duke, in case you're not aware of it, they have a good amount of resources to sort of support these innovations and entrepreneurship. I mean, Duke INE has, a lot of resources that we could be tapping into as researchers to figure out, I have this great idea, how do I then go to the next level? Really kind of starting with limited information because this is not what we're trained in. And I think there's the Small Business Technology Development Center here in North Carolina. I know that I've kind of gone to some of their workshops and get some training from them. So there's some local, things where if you're, and Duke itself can support, with their Office of Licensing and Ventures. So it doesn't have to be just an outside of Duke model.
Agree. I sit on a nonprofit board where there's a couple of sort of social venture capital firms, and they sound remarkably similar to those who are in the more for-profit space. I mean, a lot of the issues are very similar, I think, in some of those funding decisions. I'd say that I do and have only done work in medically vulnerable communities for the duration of my career. So I didn't move into an interest in for-profit commercialization explicitly because I was interested in commercialization in this space. I moved into this space because of conversations I had with leaders and community health centers and in community organizations that serve the poor, who told me in no uncertain terms that when making decisions about adopting new innovations to serve their patients, they were mostly interacting with other companies, and for good reason. I had one leader of a community health center tell me she was interested in a specific product, and it was a product that quite honestly we could have created in our research lab and given to her. In fact, I offered to do that and was very excited about making that offer to her, and she told me no and told me that they were considering this from a for-profit company at at the rate of like $200,000. And I was thinking I was going to give it to you for free. And she said no. And the reason is that, you know, we're a company. We work with other companies. And when something goes wrong, we need somebody to call. We need a customer service line. We need technical support. If something goes really wrong, we need somebody to sue. You know, we need somebody to service this account. And what struck me at that moment was that these organizations that serve the poor and that I had previously thought mostly would and should do business with other nonprofit companies actually do work with commercial firms for very good reason. There's an expectation of a solid company that has a firm infrastructure that can serve the needs of that client base, and maybe even more important in that setting than it is in others. And so that was a big reason that I've become heavily invested in this space, despite the fact that my research is fully in populations that would normally be serviced by this group.
So one last point, there are funds that do what they call impact investing. And there are lots of funds out there. In fact, right here in Durham, Investor Circle is great impact investor. So it is, it's not an area certainly that's being ignored. There's funding available, there's support available, and certainly there are great opportunities in that space.
Well, thank you so much. This has been very, very interesting and very, yeah. So, thank you.